Hi everyone, welcome to your Pharmacy Career Planning 1 course. My name is Sarah Davis and I will be your instructor for the next 10 weeks. This week we are going to be covering Chapter 1 of your textbook. As we go through any of these chapters, if you have problems or questions, please make sure that you reach out to me. You can do that either via email or via phone or text. I'm available virtually all the time, so make sure that you reach out to me rather than just not do something. So any questions that you have, make sure that you let me know. Most weeks you're going to have an assignment that can be turned in as a Word document. You can just make sure you upload that by the Sunday deadline. You'll also want to make sure that you take your weekly quizzes by that deadline. And then finally, you'll want to make sure that you're posting 3 total discussion posts each week. So each week you're required to post 1 discussion post. That's your initial post by Wednesday. And then after that, you're going to post 2 additional replies to your classmates by Sunday each week. So you'll want to make sure that you have all of those things completed every week. Again, if you run across problems or questions, though, that you're not sure about, reach out to me ahead of time. Don't wait until the last minute, obviously. So this week we're going to be covering Chapter 1, and Chapter 1 is just a very general introductory chapter. This particular chapter is all about pharmacy and the healthcare system in general. So they're going to talk to you a little bit about how the healthcare system in the United States works. And how it works in other countries as well. And so they're going to kind of compare and contrast socialized programs and decentralized programs, voluntary programs like we have here in the United States. So all of those different types of programs are going to be touched on. They're not going to get into a lot of detail, but they are going to go over each of them so you can kind of recognize them. Then they're also going to talk about the different types of healthcare personnel. So this will kind of give you a good overview of what these different people do in their particular jobs. So obviously, we know a lot about what pharmacists and pharmacy technicians do. Pharmacists are one of the largest group of healthcare providers. But their jobs have changed a lot over the years, which is kind of where this whole course comes from. You're going to see all of the different places and that both pharmacists and pharmacy technicians work now. It's a lot different. I mean, it's no longer just retail and hospital. There's a lot of other areas that they're going to be changed, that they have changed in, that you have an option to work in. A lot more specialization. These are some of the topics that we'll be covering over, like I said, the rest of this course as well as the next course. So a lot of different things that you may not be familiar with, but now's a good time to start digging into them to see if these are areas of specialty that you might be interested in. A pharmacy technician is obviously someone who's going to be working directly with the pharmacist, dispensing medications. The pharmacist is legally responsible for anything that we do. So if we make an error, it's back on them. Not to say that we don't have any responsibility. We do. However, ultimately, the supervising pharmacist is the one who is responsible. Then, of course, they're going to talk a little bit about physicians. Obviously, those are they have direct patient contact, although nowadays pharmacists and pharmacy technicians do as well, even in an acute care setting. Nurses also have a direct patient contact, depending on what level of education you have. You may be either an LPN or an RN if you fall into the nursing category. And then we have physician's assistants. So they also have a training similar to a nurse, but it's a different type of training. They can do some more basic things, obviously things like blood pressure, weight, those types of things. Allied healthcare personnel are anybody who is a support. So CNAs would fall into this category, dietitians, social workers, surgery techs, anything. When you see tech, that's going to tell you that they're usually an allied health personnel and they're there as a support. This chapter is also going to get into some of the different types of healthcare institutions. It's going to give you a very brief overview of those types of institutions and then the roles within those institutions. So, as you go through this week's material, if you have any problems or questions, please make sure that you reach out to me and have a great week.